Well, hi guys, thanks so much for tuning in and watching this video. I think it's going to be really super helpful when we get together for our personal appointments for open enrollment. You're going to have a lot better base of what we're dealing with, what the options are, and how it fits into what you guys need. This is just going to be an overview, kind of a facts and hacks of what we can do. But we definitely are going to want to make that personal appointment so that we can make sure that we fit it into your needs. Please email me back. Let's get you on my calendar. This video is not for everybody. It's for folks who are on individual health insurance plans, okay? If you're on a group health insurance plan through your work, or if you're on Medicare or Medicaid, this is not about the products that you're on. Feel free to stick around if you want to see the mess that the rest of us are in, but other than that, you might want to save yourself the time. But if you're like me, my family, and you're on an individual under 65 major medical plan, this is for you. And also beware, I'm recording this mid-September. There's still a lot of stuff going on. Things are still shaping up, but from where we stand right now, this is going to be an approach, a lot of knowledge, a lot of information. So, hopefully you can stick around through the video and get hip to it. So first thing you need to know, what big change that's taking place this year is open enrollment is now only 45 days. Open enrollment is going to go from November 1st to December 15th, and then it closes up hard. If you don't make your changes or get into a plan for Affordable Care Act plan by then, you won't have an opportunity to do it for 2018. So it's real important to get you on my calendar. This applies to Affordable Care Act plans, also known as ACA, also known as Obamacare plans. They have a Jan 1 effective date. Everything will this year. You might remember past years we had that kind of linger on for another month or so. That will not be the case. So very important to make sure if you're going to make a move, you make it. Otherwise, if you miss that window, you'll only be able to get an ACA plan if you have a special enrollment opportunity. Those are things like life events like birth, marriage, divorce, loss of employer coverage, move. There's several things, but without that, you cannot change your plan and you can't do anything if you're on an Obamacare plan. Non-Obamacare plans, and we're going to be talking about those a lot today, can be purchased year-round, and the biggest reason is because they have underwriting, so they're not. They're protecting themselves from bad risk, if you will, because you have to qualify based on your health, okay? Up here, because these are underwritten plans, no health questions, the only way the insurers can keep somebody from just waiting until they get sick and then jumping on a plan mid-year, getting that sickness taken care of and jumping back out, is that they have open enrollment. That's what that's all about, okay? So what are your options? Pretty much there's three main headings. Obamacare, like we just talked about, the ACA plans. We're going to go through those. Short-term major medical plans. We're going to go through some options there. These are not Obamacare compliant plans. And the one that's coming on and probably going to be very useful this year is fixed benefit medical plans, okay? Or some combo of the above. I had a lot of people put things together last year in certain ways. This year, because of some of the changes that have taken place, I think that's going to be a really important play. Okay, so for those three main categories or the combo idea, I've done kind of a basic analysis of those plans on this spreadsheet here. Basically, what I've done is I'm using my own family of 5 as an example, okay? And this is actually how I am, at this point, how I'm determining where to take my family for 2018. I'm going to keep that open until I know exactly what we're dealing with come open enrollment, because there could be some last-minute changes, and it looks like there may be, that will affect this decision. But if we were to look at it right here and now, frozen place in time, I'm kind of leaning toward the one over here on the right. It's a combo plan. But I'm going to take you through each of these right now. I'm going to show you with my family of 5 how these things stack up, and kind of talk about how I came to my decision that right now I'm looking at doing a combo. All right, so an Affordable Care Act major medical plan, Obamacare. This is my family of 5, all right? And there's a threshold here that if, I think it's about 115,000, where there's no subsidy. I don't qualify for any kind of subsidy, right? And anything below that, it starts to kick in, and it's kind of crazy math, because even at 112,000, bingo, magically $1,000 a month shows up. If you're in the situation where you might be right on that threshold where and it's different for individuals, about 47 grand and lower, and then and it also varies based on age. Since me and my husband are getting up there in years, the amounts go up. So you might say, how do I know if I'm going to qualify for a subsidy or not? One thing you're going to want to do is, before our meeting, is to do your best guess estimate of what your gross taxable income is going to be, okay? It's actually your modified adjusted gross income is what they use. And it's not about last year, even though you're probably going to have to use your 2017 information to make your best guess for 18. And it's lines 37 and 8B on your regular 1040. And then some things are involved and not here. You can see what it says. And do your best. Obviously, it is just an estimate. Usually a marketplace is going to want to see some kind of proof of that. So, if it's really vastly different than what your last year's taxes are, then you're probably going to have to do some further proof possibly to show what that would be. Anyway, in Illinois, they did raise the Medicaid level. So basically anything from 138% of federal poverty level and lower goes toward Medicaid. Some states it's 100% and lower is Medicaid. So everything above that becomes subsidy bound. So in Illinois, we're looking at an individual has to make at least $16,643, and they're going to get a really deep subsidy and cost sharing on their plan. Or an individual has to be under 48,240. Now, if you're younger, that number might be way too high. It falls off based on, it's a percentage of the cost of the plan to you. I'd say my 20-somethings were really more in the 30,000 range before they were getting much help. But you can see there's that magic number, the 115, where I showed you where it was dropping off. Okay, so this is something that you're going to want to do ahead of time before we meet. Get a family number that you feel pretty comfortable with. And one of the very first things you're going to say out of the box is, yeah, I qualified for a subsidy, or I don't, and we'll go from there. Okay, so now that we've looked at what it is to get a subsidy, if you know for a fact you're not going to get a subsidy, that you're above that amount, then we're going to go about this another way. But if I do think I'm going to qualify, and I have a lot of self-employed folks out there who don't know exactly where they're going to drop in, and maybe they would qualify for some help, then it's going to make a heck of a lot of sense to go into the marketplace and get that help paying for your plan, especially when we're looking at, if I take that off, for this lowest PPO that they offer is $2,000. And this is 2017 numbers. They're already predicting that these numbers are going to come up maybe 15 to 25, 30% going next year. So obviously, if you're getting $1,000 off of that, this is a whole different conversation, and we're going to want to get that money. But I'm going to show you without it, okay? And we'll go from there. So basically, this plan is a $7,000 deductible, $7,150 max out of pocket, and that's 2 times for the family. So we're talking, $14,300, and that also is going up next year. This is going to be $7,300 for the individual deductible maximum, and it will be, let's see, 14,600 for the family maximum. So they're very high deductible, a lot of exposure there. And oftentimes what I will recommend if you're going to go for something like that, you're going to want to also maybe put in at least an accident supplemental plan so that, God forbid, one of your kids slips off off of his skateboard, you're not looking at a $3,000 ER bill. You can cover that with just $20-$30 for the family. It makes a ton of sense, and you can get those things for critical illness as well. If you're looking to reduce your deductible and out of pocket, I mean, you can see that it jumps way up, and you still have a $1,750 deductible on this gold plan, and now you're looking at $3,221 worth of premium per month. Certainly a supplemental plan is a lot cheaper than that, and staying with a higher deductible, add the supplemental, and you've got a tighter package than if you left those things apart. So why would somebody go and spend all that money on a major medical plan? Okay, I'll tell you why. It's really about these things on the left side here. Everybody knows by now that the part of Obamacare is that they set up that you're required to carry health insurance. And if you don't carry health insurance, there's a penalty that may be enforced on you through your taxes. And they don't mean just any kind of health insurance. They mean Obamacare. Okay, so these non-Obamacare plans can be subject to a penalty. I have a couple of good workarounds for this, and I'll explain them. But that still stands. Obamacare is still the law of the land for all the talking you've heard out there. The law is still there. Now, there was a executive order that was passed in February of 2017 that pretty much said that the IRS has to take somebody's tax return whether or not they check that insurance box or not. Some people are saying that that's a big, huge wink that says that they're not going to enforce it. I don't know. We don't know. You'd want to discuss this with your accountant, see what he thinks. But there are some workarounds, and I'll talk about that. Maybe by the time we get into open enrollment, we'll have some news about that particular part of it. But why would somebody spend all this money on the insurance? And the question is really about this. If you're sick, if a family member is sick, you have something going on that's a pre-existing condition that needs coverage from day one, no ifs, ands, and buts, then that's why you would do that, okay? If you're fairly healthy and you can qualify for a short-term, a fixed benefit, or a combo, then these options on the right start to play in. So when you get an Obamacare plan, it's just a matter of signing up at the right time and paying your bill. There's no questions, you just get it. Over here, short-term and fixed benefits, they have health questions. The questions are qualifying questions. They're big things: cancer, heart attack, stroke, diabetes, COPD, blah, 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 all those kinds of things. And if you can answer no to those things, and they do have time frames as well, so it's usually within a 5 or sometimes 10-year look-back period. If you can answer no to those questions, then you possibly can do that, okay? The other reason is if you're having a family or starting a family, you want maternity coverage, or if somebody has mental health issues. Those are fully covered on the Affordable Care Act plans. They are not covered at all on these other options over here. Another thing is that on an Affordable Care Act plan, your wellness visits, be it your checkup, your annual checkup, your pap, mammogram, whatever, it's going to be covered for free, okay? That's just part of the rules of Obamacare. It's all preventative wellness. Anything with those kinds of medical codes are going to be covered for free. One thing to be aware of, and I've had a lot of people be confused about this, is if they're doing some kind of preventative wellness, it's coded that way, but then they discover something. It changes the coding, and now it just goes toward your deductible, okay? So it's not just they did a mammogram and it's free. If they did a mammogram and found something, it becomes diagnostic, and now you're going to pay for that. And then over to the right, those things are covered. Those mammograms, those annual checkups for your kids and stuff, they are covered, but they're just not covered for free. you're going to have a charge, probably a doctor visit. It depends on the plan, which plan and which carrier you're going with. One of the carriers that I like, and I'm going to show you actually for short term, does have free wellness for children under age 6, which is kind of nice. And here's a big thing that caused people to go toward non-Obamacare plans. Besides the price, which is roughly half, as you can see, there are no national PPO coverage plans in Illinois. I know some of my clients, some of you guys listening to this are not in Illinois, and I apologize for the Illinois-centric approach here, but just know that we're going to talk about what the options are in your state when we talk. But I'm going to stick with this since this is the majority of my book. And it's about me, and here I sit at smack dab in Illinois. So we don't have a PPO that's national coverage. All we have is a smaller Blue Cross PPO that doesn't have any of the major hospitals downtown involved in it. There's no teaching hospitals in the city like Northwestern or University of Chicago or Rush. They're not in that PPO. The short term, the fixed benefit plans do, okay? They have a national PPO coverage, and you have a lot more doctors, hospitals involved in those. And I took this out and putting it back. So basically what we're looking at real quick is these 4 options. I'm going to go through the other ones real quick here. About the penalty, back to that. One workaround for a family is $145 a month. It's a Christian Health Ministries medical bill sharing plan. I do not recommend these. They can't even call themselves insurance, and there's no hard and fast contract that they have to pay anything. They will if they can, but if they can't, they won't. So I tell people, buyer beware on that. The only thing is that they did go and lobby Washington when Obamacare started, and they got an exemption for their plan. So if you carry that, you get an exemption from the penalty. So it's your get out of jail free card. And for a family, it costs $45. For an individual, it costs, for an individual, $45. For a couple, it's $90. And for a family, it's $145. Now, I did a calculation, and I do have a calculator, that if I were to go ahead and take my chances, my possible penalty would be about $370 a month. So, I'm still coming in under, even if I had to pay that penalty, I'm still coming under what the other options are, even when you add those things up. But, this is sort of like taking a chance. And honestly, I will tell you straight up that I'm probably going to be taking a chance this year and waiting for it to come back to me if it does. But I don't know. I haven't quite made my mind up. But if I don't, I did take the Christian plan this year just to get out of the penalties, because I did do a short-term major medical plan this year for my family because it made sense. With that said, I'm going to show you real quick that plan. Now, the big thing that changed, and the reason I'm looking at a combo this year, is that so many people peeled out of Obamacare and went into short-term major medical because of exactly what I just showed you, that they scrambled, and in April, the CMS, Center for Medical Services, changed the rules so that they can only write a short-term major medical plan for 3 months. That makes it not very desirable plan. However, National General got clever and said, okay, well, if that's the case, we're going to write a policy that we can do consecutive 3 months plans. So they've already come up with a workaround that is going to be 4. You buy it once, but you're buying 4 consecutive 3-month term plans, okay? That way you're only going through underwriting one time at the beginning of the plan, and then, God forbid, in March you get sick, there's no more underwriting. The new plan will pick up right where the last one left off. Other than this, and here's the downside, is that because there are technically 4 different plans, 4 different policies, and in this case you're looking at it 2 because we're at the end of this year. then you have $4,000 or $5,000 deductibles on this particular plan that could possibly go over because the plan starts over. You will have coverage, but the plan starts over. Doesn't make it quite as an exciting a play as it did last year. Now this still could change. There's lobbying in Washington to get our 11-month plans back. And if that's the case, if that happens, then this becomes a much stronger approach. But you can see that it's a $5,000 deductible, 80/20 coinsurance out to a max of $7,000 for an individual. And I've added something I spoke of before. In this case, it's a accident and critical illness benefit that would cover that $5,000 for any kind of injuries or any kind of critical illness. You can also just do an accident benefit for a family for $27 if you want. And if you're younger, unfortunately, it's not available to me because me and my husband are too old, but there's a nice plan that has accident and inpatient hospitalization for any kind of illness plan for a supplement. So it's a little broader coverage. I can only do the critical on my family. But that would be $11.64 on an ongoing basis. There is a one-time enrollment fee. And you can see that it does increment up right now. When that second term, it comes up to $11.96. So the 4 consecutive plans would do the same thing. Okay. And if you're going to go this way, and it might make sense when you look at the numbers when we talk, you might want to double the supplement, make it a $10,000 to help bridge that that gap, between the 4 different plans. And then, so another play that I might have spoken to some of you about last year is that a fixed benefit medical plan. Fixed benefit is kind of a completely different idea. Think of a major medical plan upside down. On major med, you have to get through your deductible coinsurance, and once you do, then all of the exposure is on the insurance company, not on you. It goes to them. However, on a fixed benefit, there is no deductible. It comes in and it pays first dollar benefits for all of its services up to the amount that is stated in the policy. So it's an indemnity policy. And United Healthcare has a really nice plan. There's both in the short term and in the fixed benefit world. We have several carriers. I'm showing you the ones that work best for my age group and for my state. Okay. They have several. The biggest difference is the per day hospitalization benefit. On this lowest level one, it's $1,000 per day. Then it comes up to $2,000 a day, $4,000, and $5,000. This $5,000 a day one is very benefit rich, and you might, if you're going to do it just a fixed benefit, I'd say that either this one or that one, the $4,000 or the $5,000, is going to be the way to go. It's going to cover. It's your likelihood of having expenses over and above what the fixed amount that it pays is are pretty low. They use the multi-plan network. So the multi-plan is a national PPO. Lots and lots of doctors at hospitals. You might say, well, it's United Healthcare. How come they don't use their own network? Because this is a fixed benefit plan. Multi-plan has a different setup with that. So they made it an arrangement with multi, and it seems to work quite well. If I was going to do this one for my family only, this is the one I was looking at, okay? And I showed you on the chart. Because I believe that $4,000 a day is going to be, in most cases, completely adequate. It also does doctor visits. All of them do. You get $100 per visit. On this one, you get 5. On these lower ones, you get 2. Also, after 6 months on the plan, you get $200 for a wellness visit for everybody on the plan as well, and $100 on the lower ones. You do have some prescription drug coverage, testing, outpatient lab. So how do just to be totally clear, let's say that you went in for an outpatient x-ray and that x-ray cost $400. The plan will pay $300 and you'd be responsible for the other $100 on that. If you went to a place where it cost $200, the plan's going to pay the x-ray place $200, and then you're going to get a check for $100. And it functions that way because it is an indemnity. It pays what it states it's going to pay. So this is where you can be a good consumer and go to, for instance, there's a healthcarebluebook.com website, and put in your zip code and put in your service that you want to get done, and then it'll come up with some prices and places that you can go. It's kind of nice. Okay. Also, it has intensive care unit plan payment on this one. You know, it's, again, they step up depending on which one you're willing to pay for. But this is going to make this a lot more benefit. These things all stack on each other. So it's in addition, okay, in addition to your hospital inpatient. So that's basically a $12,000 a day benefit. If you're, and it does have 31 days per year. So if you're in there for 32, that 32nd day, you don't get that intensive care anymore, okay? And then it also has inpatient hospital physician visits. So all those things stack on top of each other to help pay your bills, whatever they might be. And there's also surgical benefits. Again, that would be stacking on top. Okay, so that's basically how that works. So that other option I showed you over here is combo, which is where I'm leaning for my family right now. What I'm suggesting is to do two things: a super high deductible short-term plan that becomes the stopgap insurance, if you will, and the fixed benefit combo plan at a lower dollar amount. I'm going to go down to the $2,000 a day plan to cover, okay? And I am opting for the short term with United Healthcare because they haven't come up with this workaround. Right now they're 3 month. I'm hoping that they catch up if we're in this place. But the reason I would do theirs is because it's just a ton cheaper, okay? And the reason it's cheaper is because they're only on the hook for 3 months. I personally would run it that way because it's about half the cost of the high deductible with Nat Gen. That's going to be a full year. And that would be at $25,000 with Nat Gen. This one's $12,500 deductible per person, 60/40 coinsurance out to another 10. So you're looking at each person on this has exposure of $22,500, which seems like, wow, what are you talking about? But what it's doing is it's if there's anything over and above what that fixed benefit is going to pay, it's going to step in and stop the expense to you up to $2 million, okay? So what I would do is I'd put that plan together with this plan, the $2,000 a day benefit one. I could go down here. I kind of like this one, and the price point works for me. So I would do that one, and the two plans would work together. When and if I'd be hospitalized, I actually walk in with both cards. I say my primary is the short-term medical, and the reason I would use that high deductible as my primary insurance, and then the secondary insurance would be this fixed benefit plan, is because the short-term medical does use the United Healthcare Choice Network, which is a huge PPO, and they are the 900-pound gorilla, and their network discounts are enormous. I mean, I've seen things knocked down to like a third of what the original price was. So you want it to go through that network first, and then let the Protector Guard fixed benefit plan pay what it pays. So let's just think about that for a second. I have an inpatient overnight, couple nights in the hospital. Let's say that that with whatever services they did ended up to be $8,000, okay? And that $8,000 first is going to be rolling through the short-term plan and getting reduced by the network discount, which let's say that comes down to $4,000, okay, for that overnight. Then obviously that's just going to go against my deductible. I wouldn't really see anything but the network discount on the short term, but then this plan's going to pick up and pay $4,000 to it. And they will coordinate. United Healthcare coordinates those two plans so that you don't have to worry about that. If it comes down to it and you end up in a better place than that and there's money's left over, they're going to pay the doctor hospital what they're owed. And if there's stuff left over from your $4,000 a day benefit, you're going to get a check from them. So that's going to be my play this year for my family. Unless things get radically changed, it could be a really good play for you guys as well. We're going to have that conversation when we talk. People always say to me, what do we do if it changes? What do we do if it changes? Is it going to change? How do we know? I'm all over this. This is all I do, guys. I'm just health insurance. I do life, supplemental, dental, vision, but health is my main thrust. So when these changes come about, I'm going to be on it. And if it's something significant, you're going to know about it, and we're going to figure out what's going to be right. You can always reach out to me. That's why I'm your broker. And we'll go from there. But it's going to be real important, most of all, to make sure that you get an appointment with me, okay? So let's make sure you reach out either by text. This is my cell phone. Email me. Oops, I just realized I didn't finish my email address.com. And we'll get you on my calendar and make sure we get you where you need to be for 2018. Thanks a lot, and thanks for hanging with me.